Hello and welcome everyone. We are glad you are joining us today. We are coming to you from the Center of Excellence for Infant and Early Childhood Mental Health Consultation. In our webinar, we will be sharing information about infant and early childhood mental health consultation messaging to stakeholders. My name is Dawn Yazzie, and I will be moderating the webinar. We are funded by SAMHSA, Substance Abuse and Mental Health Services Administration, under the Department of Health and Human Services. We also have a disclaimer we would like to share with you here. The views, opinions, and content expressed in this presentation do not necessarily reflect the views, opinions, or policies of the Center for Mental Health Services, SAMHSA, or HHS. Our presenters for today will be Kim Eason, who is the Special Initiatives Coordinator for the Wisconsin Child Welfare Professional Development System. We also have Linda Delamata, who is our Training and Technical Assistance Director with the Center of Excellence, and myself, Dawn Yazzie, as an expert mentor and also with the Center of Excellence. I will now hand this over to Linda, who will be reviewing the objectives of this webinar.
Thank you, Dawn. Hi, this is Linda Delamata. In today's webinar, we will walk through understanding the key messaging concepts of infant early childhood mental health consultation. And for the purposes of this webinar, when we see those initials, I'm going to say consultation because it's just easier than going through each one of those. And then we are going to be talking about creating an effective message about the community problems that the stakeholder is struggling with, how consultation is an effective solution, and then the role of the stakeholder in that solution. We're also going to be looking at the Center of Excellence's mental health consultation infographic that will articulate what consultation is and talk about the application. The first thing we want to talk about is why is messaging about consultation important? Why do we need to develop a message? What's it all about? We want to be creating a language that everybody understands. And when you hear the term infant early childhood mental health consultation, it is something that many people have different concepts about. So we want to create a message that gives you a picture. We have a shared language and you have a picture. So that's our mental model. We can either visualize what this is or we can all understand universally what this means. And so a mental model could be, when you think of famous mental models, maybe the Nike icon, right? We think of that and we go, oh, Nike. Or could be something that is verbal, like if you think of the ABCs. It is something that helps us to remember and have a universal language about. The other thing is we want to design a tool that we can share with multiple audiences. We might need to have something to share with people who might be looking at funding this, or people that may be looking at using this and saying, oh, consultation can address my needs because I get this, I understand this now. We also want to bring attention to consultation, and having a message that does that is one of the goals of this webinar. We want to be able to communicate why it's important. What are the benefits of consultation? What can it do for us? And we would like to promote buy-in for this work. And we want to effectively engage stakeholders through this shared vision. If we all have the same understanding of what this is, it makes it a lot more effective. So what we're going to talk about related to key messaging concepts is about developing a communication plan, and within that plan developing an effective message, using data, research, stories, and resources with messaging, and then we're going to refer to cultural considerations. When you look at a message, it isn't all by itself, sitting over here, here's our message. It is within a communication system. So we're going to show you here a 5-step communication process. The first one, step number 1, is to analyze your current situation. What do you know about your community, and is consultation there, and is it in all of your early childhood systems, or maybe it's in only one system and you'd like to make it into other systems? Have we done any kind of inventory or needs assessment? Do we think that children are being expelled? So what is going on? What is your current situation? And then the second step is identify and understand the audience. So who are you talking to? What do you want from that person? Do they already know about consultation, or do you need to be very basic and start from the beginning? And what do you want them to do? Are you looking to have someone fund this? Are you looking to help someone understand how to use it? So you just need to identify and understand who your audience is. And then you develop your message, a very clear, concise, easy to understand message. And we're going to come back to that one. After you have a developed message, then what you want to do is to create and implement your strategy. Now that I designed this message, how am I going to get it out? Who are the people that may be my intended audience? How do we reach them? Will we be doing presentations? Will we be doing social media? But how are we going to get this out? And then you want to evaluate it. Evaluation is important, and we want to find out what's working, what's not working, how do we get our best approaches after looking at this. And just like we evaluate other components of the program, we also need to evaluate the message, and does it work or do we need to change it? This is a visual on developing an effective message where you have a problem statement. You're looking at what is the problem. You have a program strategy, so how can consultation address this problem? And then you have a call to action. What do we want people to do? But it is all around our core message. What is it we want people to know? So we're going to break this down. The first piece that we're going to talk about is that core message. What do we want to convey? In our message, we need to decide what we want to talk about. What is the main message you want to share? And this message is going to strengthen your voice and strengthen your position. It is what we would like to use as a compass. Are we reaching where we're going? Are we saying what we want to say? And we have some strategic and intentional message that helps us know where we're going. So without that strategic and intentional message, we might get sidetracked and not know where we're headed. Overall, your core message is what you want to take home. It's your take-home message. One of the important pieces of it is using stories. Stories create for everyone something that is easy to remember, and it kind of brings it to life. So you might read through some paragraphs, but when you then see a picture or a message from someone who said, we received consultation and this is how it impacted us, those stories bring it to life and they make it real, and it helps us understand more. So we want to make sure that our message has some type of story. We also want to make sure there's some data, because data frequently supports what we're trying to say. It helps the stakeholders know that this isn't just a thought right now, but there is something that happens. We have something to show the impact of it. And then resources. There are materials that can be identified that supports this message. There are things already out there to help move this work forward. I am going to turn this over to Dawn now, who's going to talk to us about cultural considerations. Dawn?
Thank you, Linda. And as Linda shared earlier, I will also use the word consultation. I also work as an early childhood mental health consultant on the Navajo Nation, and I provide mental health consultation services to child care centers and preschools and home visitors on the Navajo Nation. And when I learned about this type of consultation a few years ago, I looked at my own culture and I saw that consultation concepts already exist within the traditional Navajo culture. So when we think about culture within messaging in tribal communities, it's also good to consider that for many tribes, the concepts may already exist within the communities. For example, within the Navajo traditional culture, there is a concept about unborn children having ceremonies and prayers done a month before the due date, and also thinking about when both mom and dad are expecting, both mom and dad have to honor certain ways of being, and they have to consider all levels of influence, very similar to consultation when thinking about supporting young children and their social emotional development. So for some tribes, there may be existing ceremonies and prayers that have a language title that have specific words that can be used and pulled into describing consultation to support tribal communities. And think about who are the trusted message deliverers. For example, are they elected leadership, tribal council members, tribal elders, or tribal programs for families? One thing I've noticed is tribal Head Start programs, tribal child care, development fund programs. They tend to be areas where families come for information, for gatherings, to meet other families. So your early childhood programs within your communities can be great partners when looking at using messaging within tribal communities. I will now hand this over to Linda.
Thank you. I showed you this beginning triangle a few minutes ago. Now we're going to spend some time breaking that triangle down. Remember, we're talking about everything in this concept is developed with your core message in mind, and we're going to look at the problem statement. What problem are you addressing and why is it important? Your program strategy. How can consultation address the problem in a way that resonates with your audience? And your call to action. What steps are you hoping that your audience is going to use so that you get better outcomes? So let's take that first one, that top green triangle. We want to know about the problem statement related to consultation. I'm going to walk us through an example of a presentation that was given using this triangle to kind of understand how that happened. We are talking in this case about suspension and expulsion. The question is, what gets in the way of a child's success? In this presentation, they talked about how suspension and expulsion are considered exclusionary discipline problems, and many times it's because of a child's behavior. So we say that child needs to leave their setting. That's the beginning of the problem, and the next part of it is that what does it look like? In this presentation, they just walked through the things that happen when a child is expelled. Like they are permanently removed, or maybe they're only removed for a few days, or possibly they vary their hours and they say you can come for 2 hours a day instead of a full day, or maybe because of difficult behaviors they are not allowed to be in the social settings. So that is what we're talking about when we say suspension and expulsion. And typically the behaviors they see, and then they identify in this what those behaviors are. But then they say at the very end, behavior is how young children are communicating. So the problem is suspension. This is how you get to suspension. But there are impacts that happen here. If you are suspended, there are issues related to how you progress academically, social and emotionally, and if it takes a while to get the services you need, that means that the child isn't having that opportunity to learn and grow. It also affects parent employment, because if your child was enrolled in a child care or preschool setting and that child isn't getting what they need, they're suspended. You have to find other ways to provide for them, which means you may end up missing work or needing to not be at work because you're taking care of. So that's an impact. And then there's a long-term impact, which talks about 10 times more likely to drop out of high school and be held back or become incarcerated, which is a huge impact. And then the last one is suspending people. That is not effective. It doesn't prevent future instances. It doesn't show that it helps with any type of behavior concerns. These 3 slides have identified what the problem is. Our problem statement is we're using suspension and expulsion. It impacts children in many different ways, including parents, and it has no positive long-term effect. That was the problem part of the message. And then we're looking at, well, what are some of the program strategies that we can use? How can consultation address this problem that the audience might say, hey, yeah, that's it, I get it now. In their presentation, they talked about there are 50% fewer expulsions reported by teachers who have regular mental health consultation support. That's a huge message to give, right? So we have the reason that suspensions are very negative, but if you look at using infant mental health consultation, then we're seeing 50% fewer expulsions reported. And we also are going to say that consultation itself creates a nurturing environment where children and teachers are, and that helps get in place some effective intervention, because we know that suspension and expulsion are not effective. So it talks about how we partner with professionals to create opportunities for change, and that there are new resources, and it offers referrals to services and programs that support that children's well-being while they're still in that setting. So this is what can help. This is the strategies. As we're talking to an audience, and this particular audience was an audience who could look at how to help with some funding, then we say, okay, how do we do a call to action? What are some of the steps that your intended audience can do for better outcomes? This particular presentation then talked about we want all children to have an opportunity to have positive early care and education experiences. Some states can respond to children's behavior by reducing that need. And of course, we know that a lot of that is about social, emotional, mental health, but policy decisions. So this group of stakeholders, we're asking them to look at policies. They also ask about a systems approach where you can build and expand on your prevention and intervention efforts. And then using unifying strategies across departments that support social and emotional development and classroom success. Then providing some comprehensive strategies for children, their families, and educators. Here's your solution. Let's look at your social and emotional supports for children and make it universal and build on what you already have. And this particular stakeholder group has the ability then to look at policies, procedures, fundings, etc. So that was their message. So now we're going to talk about some tools. The Center of Excellence has an infant early childhood mental health consultation infographic. We're going to review that. Then we're going to look at the toolbox for the Center of Excellence. We have a very well-designed and informative toolbox that you may be able to use as you look at your message. And we're going to hear from one state about how they've developed messaging in Wisconsin. So let's talk about this one-page clear and concise message. What you want in a message is something that is easy to understand. You can look at it, it's clear, and it tells you what it is you need to have. Sometimes all you have is a few minutes with an audience, and you don't have time to give them a 4-page definition, and you don't have time to walk through all of the nuances of consultation, because there is quite a bit involved in that. So what you want to do is to have something that really gives a clear message and has that mental model so that I can picture this. We're going to show you now what that looks like in the Center of Excellence's model. Consultation is a triadic experience. You know, you have 3 people in 3 different audiences involved. First, you have the accessible mental health. So you have a qualified mental health consultant, and that person is able to provide directly to the providers. If you look at the lower left-hand corner there, you have your qualified mental health consultant, and you see the green arrow that points directly at the capacity building of the child and family providers. That goes directly to the teacher, the home visitor, early intervention, but the ones who provide the support to the children and the families. So the arrow then goes directly from the providers to the young children because they provide the support. But your mental health consultant is working directly with the providers with an indirect impact on the children and families. You don't see the arrow going directly from the mental health consultants to the young children because it is an indirect service. And that's why this is such an easy to understand triangle. It is showing those relationships and how they work. And then over here you'll see that it says fostering nurturing environments where healthy relationships grow so children can succeed. And in your graphic, you've got nurturing environments with a hand that is holding this relationship. So we're making a partnership with the providers in order to support the connection that helps young children and their families grow and develop. The bottom part of this graphic is where we talk about consultation being in various settings and it's a mental health service based on principles of prevention, consultation, and infant early childhood mental health. The whole goal is to strengthen the providers in what they do to help the children. So it brings mental health supports into those natural settings. If, the mental health consultant works in the daycare setting, works in the early care and education setting, works directly with home visitors as they work with families. And the goal is to build the capacity of the providers to create the nurturing environments where children learn and grow. And the whole goal then is that young children will succeed in learning and relationships. So it's very simple. It walks through all of the things that consultation does. It shows that triadic relationship, and it helps us understand consultation in one visual. So we're going to spend a minute and show you that the Center of Excellence has a toolbox, and in that toolbox we have a section on messaging that really has some wonderful information in it. And you'll be able to search for some of the things you've seen already. And then we're going to just kind of walk through this very quickly. The first thing that you'll see is that you want to go to the toolbox resources, and there's a PowerPoint presentation there that you are welcome to use that comes straight from the toolbox. Or you can take the slides and use whichever slides you want. It is filled with lots of information, and we're just going to show you a few things that you might be interested in. So here's one, the important things that you might look for, like here's some data, and here are some other things that are related to consultation that you may say, I want to use that in my message. How do we qualify consultants? What are some of the positive outcomes? So please take a look at the toolbox and walk through some of those resources because they're there to help you. Another thing we wanted you to see is that we have a lot of information on messaging in the toolbox. So if you look at the content after you click on messaging, it'll talk to you about an elevator speech, the framework. You're going to see in a minute that some of the things we saw in this particular webinar are also available to you in the toolbox, and that we'll talk about messaging in general, why we ask for it, and then it goes specifically to messaging about consultation. The toolbox is rich with lots of materials. Please spend some time going through that because I think you'll find it just very helpful. So I'm going to turn this over now to Kim Etham from Wisconsin, who's going to talk to you about how they looked at developing their message in their state. Okay, Kim, thank you.
Thank you, Linda. I just want to give you a little bit of a context about where our infant mental health consultation initiative sits in Wisconsin. In Wisconsin, our Children's Mental Health has a collective impact initiative. And for those of you who might not have heard about collective impact, it takes a wide variety of stakeholders and asks them to find a common agenda for a complex problem. So for us, it's children's mental health, and to work together and use data and all of their different perspectives to come together on the problem. Because they feel like in collective impact that if you are going to have a lasting solution, you need to coordinate all of the different efforts. So in Wisconsin, part of the reason we decided to become a part of the collective impact is because it gave us that multidisciplinary approach, which would help us increase our reach. But most importantly, it also gave us parent voice. Because in collective impact, they feel it's important to have the parent voice at all levels, and they have parents who are co-chairs of every committee, including the Executive Council, and parents are reimbursed for their contribution to those committees. We thought that as we moved consultation forward, it was very important to have all of that support with us. So when we applied as a pilot site to be a part of the effort to promote the infant early childhood mental health consultation, we proposed a cross-system set in there. And when we thought about our messaging, we wanted to make sure that we hit all of the different disciplines that we were thinking about. We started with a basic message that would just talk about, as Linda was talking about, the core message. So for us, our core message was helping adults help children succeed. Because when we explained infant mental health consultation to people, they sometimes thought it was a direct service to the child. And as Linda had said, it is a service to adults that help children. And so when Linda and Liz Bichio were in Wisconsin helping us think about our data system, Liz drew this triangle that now has become the beautiful infographic that Linda showed you. But here in Wisconsin, we used that concept to try to show how the consultant helps the adults who then help the children. So on each one of our messages, we wanted to keep that as our consistent message and our core message. We use the definition of infant mental health consultation along with the triangle concept to be that Nike swish that helps hold it in people's minds of what it is. And then we used why it matters. So the data and the research we put in the bottom of our one-pager that then shows some of the statistics that Linda was talking about that we got from the toolbox. So we talked about why it's necessary that children are being expelled from daycare and that consultation helps with that. When we use all of the different messaging for the different disciplines, we try to keep the front page fairly consistent. The one thing we do change is the color because we wanted to color code each of the disciplines so that we could make a distinguished flyer for them so that when we were grabbing it, if we were hurrying out the door, we would be able to tell what discipline we were working with. But we also wanted to talk about how it works. On the back of each one is where we get more specifics, and we talk about consultation in each of the disciplines. And so in this general one, we just talk about some of the advantages of it and then talk about the keys to success, which would then lead us to the call to action. So the keys to success sort of sets up, depending on who we're asking, what we might have the ask be of that particular discipline. Here is one that we did for foster care. So how would we use consultation in foster care? And as you see, we changed the color here, but we kept the core message the same. And then the definition of consultation again is the same, but changed out the why it matters and used some of the statistics that would be pertinent to child welfare. And then on the back, when we talked about how it worked, we had some of the same basic concepts about the approaches and the outcomes, but made them more specific to child welfare. And then as Linda had been talking about in the toolbox, we got the idea to have a specific story. So we did a little vignette on what it might look like to have consultation for the adults who were supporting children who were in foster care. Then we talked about the keys to success and how that would look in child welfare. We have been doing that for each of the disciplines, and we have worked with home visiting, early care and education, child welfare, early intervention, and the medical field. And we have taken these drafts of the one-pagers that we've had and gone to the different stakeholders in these groups, including parents, and asked them to help us make these one-pagers better. So right now what you're seeing are the first drafts of those, but we have over the last month been going to stakeholder groups and collecting their comments so that we can improve the one-pagers that we have. We also use this as message for the legislators and for the governor's cabinet. We recently had a change in administration in Wisconsin, so we are going to use these to go and talk to the different secretaries of the different departments to give them a snapshot of what consultation is, and to the legislators so that they have an idea of what it is, so that if we ask for funding, they'll know what it is that we're asking for. We have been excited to build on what we've learned from other people, from Illinois, from Connecticut, from Arizona, from Minnesota, and we want to be able to share this same template. So if you like what you see on here, please feel free to use any of the information. There's a resource slide at the end of here where we have gotten some of the statistics and resources from, but we really wanted to be able to develop these messages so that all of the different disciplines could use them. Now, Linda, I'll hand it back to you.
Thank you, Kim. I'm excited about this messaging that Wisconsin has done. I've loved the fact that they have a very basic concept. It's on 2 pages. It's easy to understand, and that it's adaptable for the different settings. And as we looked at the different settings that you as an audience are at, there's a wide variety of settings, even some I've not heard of before. If you are interested in learning about this, just take a look at the resources at the end of the slide. And thank you, Kim, for doing such a beautiful job of that. Basically today, some of the takeaway we hope that you have is that your message is simple, understandable, and concise. So as we've looked at several of the messages, the one from the Center of Excellence, the infographic, it's on one page. You see the triadic relationship by looking at the triangle. It talks in general about some very specific things, but it doesn't go into detail in anything. So that's one example of a very simple and concise message. And then if you look at the ones that were shared by Kim from Wisconsin, same thing. One page front and back, basic message. She included stories because that catches your attention, the graph because that is kind of your logo, and things that people need to know as we are looking at why we need this, some of the data that she put in there. So your message is short, understandable, and concise, and that it connects to the issues that mental health consultation can provide for you, and then that it promotes whatever actions your audience can influence. As Kim was mentioning, they are taking their message to different stakeholders, have them take a look at it and let them know, does it resonate with them or not, and to go to the new legislators to make sure they understand what consultation is about, because they're the group that can activate funding as well as make some changes in policy. So whatever influence you're looking for, you adapt your message for that. All right, thank you. I'm going to turn this back over to Dawn Yazzie then.
Thank you, Linda. I really appreciate everyone's participation and everyone following along with us, and hopefully this has been helpful for you in thinking about the different populations and service providers that you want to support. Thank you, Linda, and thank you, Kim, for presenting today. Thank you, everyone.